Question 1. Risk assessment procedures indicate that a novel percutaneous embolization technique for a complex arteriovenous malformation has shown promising preliminary results in a limited number of cases published in a foreign journal. The patient is a suitable candidate, and the referring physician is eager to proceed. What is the most appropriate next step for the interventional radiologist? Option A. Implement the technique immediately, as the published results suggest it is a safe and effective alternative to current treatment options. Option B. Initiate a formal institutional review board (IRB) or ethics committee submission for review and approval of the proposed technique, alongside a comprehensive literature review and consultation with interventional radiology and vascular surgery colleagues to assess feasibility and patient-specific risks. Option C. Request a detailed protocol directly from the authors of the foreign publication and proceed with the intervention after adapting it to the local setting and obtaining patient consent. Option D. Proceed with the intervention after obtaining informed consent from the patient, given the promising preliminary results and the referring physician's enthusiasm. Correct answer is B. Initiate a formal institutional review board (IRB) or ethics committee submission for review and approval of the proposed technique, alongside a comprehensive literature review and consultation with interventional radiology and vascular surgery colleagues to assess feasibility and patient-specific risks. Explanation. Scenario analysis. This scenario presents a common challenge in interventional radiology where a novel technique, while promising, carries inherent risks and lacks extensive peer-reviewed data. The professional challenge lies in balancing the potential benefits of an advanced treatment for a complex patient with the ethical and regulatory obligations to ensure patient safety and informed consent, especially when established protocols are not yet in place. The absence of widespread clinical validation necessitates a higher degree of caution and a more rigorous approach to decision-making. Correct approach analysis. The correct approach emphasizes a comprehensive, multifaceted evaluation that aligns with best professional practices and regulatory expectations for novel interventions. This includes thorough literature review, consultation with experts, a detailed institutional review board (IRB) or ethics committee assessment, and meticulous patient selection and informed consent. This approach ensures that the decision to proceed is based on the most current available evidence, expert opinion, and a robust ethical framework, prioritizing patient well-being and adherence to institutional and professional guidelines. The emphasis on a multidisciplinary team and a formal risk-benefit analysis directly addresses the need for due diligence when deviating from standard care. Incorrect approaches analysis. Proceeding without a formal IRB or ethics committee review is a significant regulatory and ethical failure. The American Board of Radiology, as a certifying body, expects its diplomates to adhere to established ethical principles and institutional policies, which invariably include oversight for novel or experimental procedures. Such oversight is designed to protect patients and ensure that research or advanced techniques are conducted responsibly. Implementing the technique based solely on a single promising case study from a different institution, without independent institutional review or expert consultation, demonstrates a lack of due diligence. This approach bypasses critical safety checks and may not account for the specific resources, expertise, or patient population at the current institution. It risks patient harm due to unforeseen complications or inadequate management. Relying solely on the patient's expressed desire for the novel treatment, without a thorough independent assessment of risks, benefits, and alternatives by the medical team, constitutes a failure in the physician's fiduciary duty. While patient autonomy is paramount, it must be exercised within the bounds of sound medical judgment and ethical practice, which requires the physician to provide comprehensive information and guidance. Professional reasoning. Professionals facing such situations should employ a structured decision-making process. This involves 1. Identifying the novel aspect of the intervention and its potential risks and benefits. 2. Conducting a comprehensive literature search and assessing the quality and quantity of existing evidence. 3. Consulting with relevant specialists within and outside the institution. 4. Engaging the institutional review board or ethics committee for formal review and approval, especially if the intervention deviates significantly from standard practice or involves investigational aspects. 5. Performing a rigorous risk-benefit analysis specific to the individual patient. 6. Ensuring a detailed and transparent informed consent process that clearly articulates the experimental nature of the procedure, potential risks, benefits, and alternatives. This systematic approach ensures that patient safety and ethical considerations are prioritized while allowing for the responsible advancement of medical practice. Question 2. Compliance review shows that a referring physician has requested a CT scan with intravenous contrast for a patient with a documented history of a severe allergic reaction to iodinated contrast media. The radiologist is aware of the patient's history and the potential risks associated with contrast administration. What is the most appropriate course of action for the radiologist in this situation? Option A. Administer the contrast-enhanced CT scan after consulting with the referring physician to confirm the clinical necessity and implementing institutional protocols for premedication and emergency preparedness. Option B. Proceed with the contrast-enhanced CT scan without any additional precautions, assuming the risk of a repeat severe reaction is low. Option C. Administer a different type of contrast agent that is not iodinated without consulting the referring physician or reviewing institutional guidelines for its use in allergic patients. Option D. Refuse to perform the contrast-enhanced CT scan, recommending an alternative non-contrast imaging study without further discussion with the referring physician. The correct answer is A. Administer the contrast-enhanced CT scan after consulting with the referring physician to confirm the clinical necessity and implementing institutional protocols for premedication and emergency preparedness. Explanation. Scenario analysis. This scenario presents a common challenge in radiology practice where a referring physician requests an imaging study for a patient with a history of contrast allergy. The challenge lies in balancing the diagnostic necessity of contrast-enhanced imaging with the patient's safety and the physician's ethical and legal obligations to manage potential adverse reactions. The radiologist must consider established protocols, available alternatives, and the patient's specific risk factors. Correct approach analysis. The correct approach prioritizes patient safety while still aiming to achieve the diagnostic goals. This involves a thorough risk-benefit assessment, consulting with the referring physician to understand the clinical indication and the necessity of contrast is paramount. If contrast is deemed essential, implementing appropriate prophylactic measures and having emergency response protocols in place demonstrates adherence to best practices in patient care and aligns with the principles of minimizing harm, a core tenet of medical ethics and radiology practice guidelines. This approach reflects a proactive and responsible management of potential complications, ensuring the patient receives the most appropriate care within acceptable risk parameters. Incorrect approaches analysis. One incorrect approach involves proceeding with contrast administration without any specific precautions or consultation, assuming the risk is negligible. This fails to acknowledge the documented risk of contrast reactions, however rare, and violates the principle of informed consent and due diligence. Could lead to a severe adverse event, resulting in patient harm and potential legal ramifications for the healthcare provider and institution. Another incorrect approach is to outright refuse the contrast-enhanced study without exploring alternatives or understanding the clinical necessity. This can impede patient care and may not be justifiable if the benefits of contrast outweigh the risks with appropriate management. It demonstrates a lack of collaborative problem-solving and potentially a failure to meet the patient's diagnostic needs. A third incorrect approach might be to administer a different, unproven contrast agent without proper justification or establish protocols for its use in patients with known allergies. This introduces an unknown risk profile and deviates from evidence-based practice, potentially exposing the patient to unforeseen adverse effects. Professional reasoning. Professionals facing this situation should engage in a structured decision-making process. First, clearly identify the patient's history and the specific clinical question. Second, assess the necessity of contrast for answering that question. Third, evaluate the patient's risk factors for adverse reactions. Fourth, consult with the referring physician to discuss alternatives and the rationale for contrast. Fifth, if contrast is deemed necessary, implement established institutional protocols for prophylaxis and emergency management. Documenting all discussions and decisions is crucial for patient care and legal protection. Question 3. Market research demonstrates a significant increase in the availability and marketing of a novel, high-resolution ultrasound system that promises enhanced visualization of superficial soft tissues, potentially improving the diagnosis of certain musculoskeletal conditions. The department is experiencing pressure to acquire this system to remain competitive and offer cutting-edge services. However, the existing ultrasound equipment is functional and adequately serves the current patient population for general diagnostic purposes. Which of the following represents the most appropriate course of action for the imaging department? Option A. Immediately proceed with the acquisition of the new ultrasound system, leveraging the market research to enhance the department's competitive standing and attract new patient referrals. Option B. Prioritize the acquisition of the new ultrasound system based on its advanced features, assuming it will inherently lead to better patient outcomes and justify the investment. Option C. Replace the existing ultrasound equipment with the new system to ensure the department is utilizing the most advanced technology available, thereby improving overall diagnostic capabilities. Option D. Initiate a comprehensive review of the new ultrasound system's clinical efficacy, safety profile, and integration into existing workflows, consulting relevant professional guidelines, and assessing its impact on patient care and resource allocation before any acquisition decision. The correct answer is D. Initiate a comprehensive review of the new ultrasound system's clinical efficacy, safety profile, and integration into existing workflows, consulting relevant professional guidelines, and assessing its impact on patient care and resource allocation before any acquisition decision. Explanation. Scenario analysis. This scenario presents a common challenge in medical imaging departments, balancing the need for advanced diagnostic capabilities with resource allocation and patient safety. The pressure to adopt new technologies, driven by market research and perceived competitive advantage, can sometimes overshadow the fundamental principles of appropriate imaging selection and radiation safety, which are paramount under American Board of Radiology, (ABR), guidelines and U.S. federal regulations, e.g., FDA regulations for medical devices, ACR practice parameters. The professional challenge lies in critically evaluating the utility of a new modality against established protocols and patient needs, rather than succumbing to market trends. Correct approach analysis. The correct approach prioritizes a thorough, evidence-based evaluation of the new modality's clinical utility and safety profile before widespread adoption. This aligns with ABR's emphasis on understanding the physics, biological effects, and clinical applications of imaging modalities, as well as the ethical responsibility to provide the most appropriate care. Specifically, this involves consulting relevant professional guidelines, e.g., American College of Radiology, ACR practice parameters and technical standards, assessing the modality's impact on patient outcomes, and ensuring adequate training and quality assurance protocols are in place. This systematic approach minimizes unnecessary radiation exposure, optimizes diagnostic accuracy, and ensures compliance with regulatory requirements for medical imaging. Incorrect approaches analysis. One incorrect approach involves immediate adoption based solely on market research and the perceived competitive advantage. This fails to adhere to the principle of ALARA, as low as reasonably achievable, for radiation-based modalities, and overlooks the potential for misapplication or overuse of advanced technologies, which could lead to increased costs without commensurate clinical benefit. Ethically, it prioritizes business concerns over patient well-being and diagnostic appropriateness. Regulatory failure could occur if the modality is not properly validated, or if its use leads to noncompliance with FDA regulations or state-specific radiation control laws. Another incorrect approach, focusing on cost reduction by replacing existing modalities without a comprehensive clinical needs assessment, is also flawed. While cost-effectiveness is a consideration, it cannot be the sole driver for modality selection. This approach risks compromising diagnostic quality or patient access to necessary imaging if the replaced modality offered unique diagnostic capabilities not replicated by the new one. It also fails to consider the learning curve and potential for initial errors with a new system, which could negatively impact patient care and departmental efficiency. A third incorrect approach, prioritizing the acquisition of the latest and greatest technology without considering the specific patient population served or the existing diagnostic capabilities, is a direct contravention of best professional practice. This can lead to the acquisition of underutilized or inappropriate equipment, diverting resources from more pressing needs. It also fails to demonstrate due diligence in ensuring the technology aligns with the institution's mission and the diagnostic challenges it faces, potentially leading to suboptimal patient care and inefficient resource management. Professional reasoning. Professionals should adopt a decision-making framework that begins with identifying a clinical need or a potential improvement in patient care. This is followed by a rigorous review of evidence-based literature and professional guidelines to assess the efficacy and safety of potential solutions, including new imaging modalities. A cost-benefit analysis, considering not only financial costs but also clinical benefits, risks, and resource implications, is crucial. Finally, implementation should be phased, with robust training, quality assurance, and ongoing evaluation to ensure optimal patient outcomes and regulatory compliance. Question 4. Implementation of a comprehensive review of a patient's recent abdominal CT scan reveals a small, hypodense lesion in the right lobe of the liver. The patient's clinical history indicates a recent viral illness and no known history of malignancy. The radiologist must determine if this finding represents a clinically significant abnormality requiring further investigation or a benign finding. Option A. Suggest the lesion is an artifact of imaging technique and dismiss it without further consideration, assuming it will resolve on subsequent scans. Option B. Immediately recommend a liver biopsy to definitively characterize the lesion, citing the presence of any hypodense lesion as inherently suspicious. Option C. Conclude the lesion is a simple hepatic cyst, a common benign finding, and recommend routine follow-up based on its appearance and the absence of concerning clinical factors. Option D. Report the lesion as a probable metastatic deposit and recommend immediate oncological consultation without further characterization or correlation. The correct answer is C. Conclude the lesion is a simple hepatic cyst, a common benign finding, and recommend routine follow-up based on its appearance and the absence of concerning clinical factors. Explanation. Scenario analysis. This scenario presents a common challenge in diagnostic imaging, distinguishing subtle, potentially pathological findings from benign anatomical variants or imaging artifacts. The professional challenge lies in the radiologist's responsibility to accurately interpret images, which directly impacts patient care, treatment decisions, and resource utilization. Failure to identify an abnormality can lead to delayed diagnosis and treatment, while misinterpreting a normal finding as abnormal can result in unnecessary patient anxiety, further investigations, and increased healthcare costs. The radiologist must possess a comprehensive understanding of normal anatomy, common variations, and potential artifacts, coupled with the ability to apply this knowledge critically to each individual case. Correct approach analysis. The correct approach involves a systematic and thorough review of the entire imaging study, correlating findings with the patient's clinical history and relevant prior imaging. This methodical process ensures that all areas of the scan are evaluated and that any identified abnormality is considered within its clinical context. The radiologist must leverage their extensive knowledge of normal anatomical structures and their typical appearance across different imaging modalities. Furthermore, they must be adept at recognizing common imaging artifacts that can mimic pathology. By comparing the current findings to established norms and considering the patient's specific presentation, the radiologist can confidently differentiate between normal and abnormal, thereby providing accurate diagnostic information. This adheres to the core ethical and professional responsibility of providing competent and evidence-based medical interpretation, as expected by regulatory bodies overseeing medical practice and board certification. Incorrect approach is analysis. One incorrect approach involves focusing solely on a single, striking finding without considering the broader context of the study or the patient's clinical information. This can lead to overinterpretation of an artifact or a normal variant, resulting in a false positive diagnosis. Such an approach fails to meet the standard of care and the ethical obligation to provide a comprehensive and accurate interpretation. It also risks violating professional guidelines that emphasize thoroughness and contextualization of findings. Another incorrect approach is to dismiss a subtle finding as insignificant without adequate consideration or correlation. This could be due to a lack of familiarity with rare but clinically relevant variations or early signs of pathology. This oversight can lead to a false negative diagnosis, with potentially severe consequences for the patient due to delayed diagnosis and treatment. This approach demonstrates a deficiency in diagnostic acumen and a failure to uphold the radiologist's duty of care. A third incorrect approach is to rely heavily on automated or AI-driven interpretation tools without independent critical review. While these tools can be valuable aids, they are not infallible and can sometimes misinterpret findings or fail to detect subtle abnormalities. The radiologist's ultimate responsibility is to provide a human interpretation, integrating their expertise with any technological assistance. Over-reliance without critical oversight can lead to errors that would have been caught by an experienced human eye, thus failing to meet professional standards of independent judgment. Professional reasoning. Professionals should approach image interpretation with a structured methodology. This begins with a review of the patient's clinical history and the reason for the examination. Next, a systematic review of the entire imaging study is performed, systematically examining each anatomical region and slice. Findings are then correlated with normal anatomical expectations, common variations, and potential artifacts. Any deviation from the norm is carefully evaluated for its clinical significance, considering the patient's history and any available prior imaging. This iterative process of observation, correlation, and critical evaluation allows for the confident identification of normal versus abnormal findings, ensuring the highest quality of patient care and adherence to professional and regulatory standards. Question 5. The risk matrix shows a new imaging modality with promising preliminary data for improved lesion detection in a specific oncologic indication, but with limited long-term outcome data and a higher radiation dose compared to current standard imaging. Which approach best balances innovation with patient safety and regulatory compliance? Option A. Conduct a prospective, multi-institutional clinical trial to rigorously evaluate the modality's diagnostic accuracy, impact on patient management, and safety profile before considering wider adoption. Option B. Utilize the new modality only for patients who have failed standard imaging techniques and for whom alternative diagnostic options are exhausted. Option C. Adopt the new modality immediately for all eligible patients, relying on the manufacturer's claims of superiority and the experience of early adopters. Option D. Implement the new modality broadly across the department for all patients with this oncologic indication, assuming the preliminary data indicates a significant advancement. The correct answer is D. Implement the new modality broadly across the department for all patients with this oncologic indication, assuming the preliminary data indicates a significant advancement. Explanation. Scenario analysis. This scenario presents a common challenge in clinical imaging where a new technology, while promising, carries inherent uncertainties regarding its diagnostic accuracy and potential for patient harm. The professional challenge lies in balancing the potential benefits of improved diagnostic yield and patient outcomes against the risks of misdiagnosis, unnecessary procedures, and radiation exposure. The decision-making process requires a thorough understanding of the technology's limitations, the specific clinical context, and the established standards of care, all within the regulatory framework governing medical imaging in the United States. Correct approach analysis. The correct approach involves a systematic, evidence-based evaluation of the new imaging modalities, performance characteristics, and safety profile in the context of the specific clinical application. This aligns with the American Board of Radiology's emphasis on physician responsibility for patient care and the ethical imperative to utilize imaging judiciously. Regulatory guidelines, such as those from the FDA concerning medical device approval and use, and professional society recommendations, underscore the need for validated performance metrics and a clear understanding of when a new technology offers a demonstrable advantage over existing methods. A phased implementation, starting with controlled studies or specific patient populations where the benefit is most likely to be realized, is a prudent strategy that minimizes widespread risk while allowing for data collection to inform broader adoption. This approach prioritizes patient safety and diagnostic efficacy, adhering to the principles of responsible innovation and evidence-based medicine. Incorrect approaches analysis. Adopting a new imaging modality solely based on its novelty or marketing claims, without rigorous validation of its diagnostic accuracy and safety, represents a failure to uphold professional responsibility and potentially violates regulatory expectations for the safe and effective use of medical technology. This approach risks exposing patients to unnecessary radiation or leading to misdiagnoses due to unproven performance. Implementing a new technology without adequate training for the interpreting physician or technologists is a direct violation of patient safety standards and could lead to suboptimal image acquisition or interpretation, increasing the likelihood of diagnostic errors. Relying on anecdotal evidence or the experience of a single institution without broader validation ignores the need for generalizable evidence and can lead to the premature adoption of technologies that may not be broadly beneficial or safe. This approach lacks the systematic evaluation required by regulatory bodies and professional standards. Professional reasoning. Professionals faced with evaluating new imaging technologies should employ a structured decision-making process. This begins with identifying the clinical question the new modality aims to answer and assessing whether existing technologies are inadequate. Next, a thorough literature review and examination of available performance data, sensitivity, specificity, predictive values are crucial. Consultation with colleagues, imaging physicists, and relevant professional societies can provide valuable insights. A risk-benefit analysis, considering diagnostic accuracy, potential for harm, radiation dose, contrast reactions, procedural risks, cost-effectiveness, and impact on patient management, is essential. If the evidence suggests potential benefit, a pilot study or phased implementation within a controlled environment, with clear performance monitoring, is recommended before widespread adoption. This systematic approach ensures that patient care is optimized and that the use of new technologies is both safe and effective, aligning with the ethical and regulatory expectations of the American Board of Radiology. Question 6. Investigation of X-ray imaging techniques for a pediatric patient presenting with acute abdominal pain and suspected appendicitis. What approach best balances diagnostic accuracy with the imperative to minimize radiation exposure, adhering to the principles of responsible medical imaging practice within the United States regulatory framework? Option A. Declining to perform an X-ray examination due to concerns about radiation exposure, opting for clinical observation alone. Option B. Utilizing standard adult radiography protocols for consistency, assuming the diagnostic image quality is sufficient for appendicitis evaluation. Option C. Employing pediatric-specific X-ray protocols that optimize image quality at the lowest achievable radiation dose, utilizing appropriate collimation and exposure factors. Option D. Opting for high-dose fluoroscopic imaging to ensure the most detailed visualization of the abdominal organs. The correct answer is C. Employing pediatric-specific X-ray protocols that optimize image quality at the lowest achievable radiation dose, utilizing appropriate collimation and exposure factors. Explanation. Scenario analysis. This scenario presents a professional challenge for a radiologist interpreting X-ray images of a pediatric patient with suspected appendicitis. The challenge lies in balancing the need for diagnostic accuracy with the imperative to minimize radiation exposure, particularly in a vulnerable pediatric population. The radiologist must consider the specific X-ray imaging techniques employed, their inherent risks and benefits, and the evolving understanding of radiation's long-term effects on children. This requires a nuanced judgment that goes beyond simply obtaining a clear image, emphasizing the ALARA, as low as reasonably achievable, principle within the context of diagnostic necessity. Correct approach analysis. The correct approach, which prioritizes the use of the lowest effective radiation dose while ensuring diagnostic image quality, represents best professional practice. This aligns directly with the American Board of Radiology's emphasis on responsible radiation use and patient safety, as outlined in their educational materials, and reflected in broader U.S. regulatory frameworks such as those from the FDA and NCRP. The principle of ALARA is a cornerstone of radiation protection in medical imaging, and its application in pediatric radiography is especially critical due to increased radiosensitivity and longer potential lifespan for radiation-induced effects. Employing techniques that optimize image acquisition at reduced doses, such as appropriate collimation, KVP and M as selection, and potentially utilizing digital radiography systems with dose reduction features, directly supports this principle. Incorrect approaches analysis. One incorrect approach would be to utilize standard adult radiography protocols without modification for a pediatric patient, even if the resulting image appears diagnostically adequate. This fails to adhere to the ALARA principle by potentially delivering a higher radiation dose than necessary for the smaller anatomy and thinner tissues of a child. This represents a regulatory and ethical failure to optimize radiation protection for a sensitive population. Another incorrect approach would be to forego X-ray imaging altogether due to radiation concerns, even when clinically indicated for suspected appendicitis. This is a failure of diagnostic responsibility. While radiation minimization is crucial, withholding a necessary diagnostic study that could lead to timely and appropriate treatment is ethically and professionally unacceptable. The potential harm from delayed diagnosis and treatment can far outweigh the risks of a carefully considered diagnostic X-ray. This approach neglects the primary duty to diagnose and manage disease. A third incorrect approach would be to employ advanced imaging techniques that are not specifically indicated for the initial diagnosis of appendicitis in a pediatric patient, solely to achieve perceived superior image quality, without a clear clinical justification for the increased radiation dose or cost. This violates the principle of using the most appropriate and least invasive diagnostic method, potentially exposing the child to unnecessary radiation and resources without a commensurate diagnostic benefit. Professional reasoning. Professionals should approach such scenarios by first thoroughly reviewing the clinical indication for the X-ray. They must then consult established pediatric imaging protocols and guidelines that emphasize dose optimization. This involves considering factors such as patient size, anatomical region, and the specific diagnostic question. A critical step is to select imaging parameters, KVP, as collimation, that provide the necessary diagnostic information while minimizing radiation dose. If digital radiography is available, leveraging its dose reduction capabilities is paramount. Continuous professional development and staying abreast of evolving recommendations from bodies like the ACR and NCRP are essential for informed decision-making regarding pediatric X-ray techniques. The decision-making process should always be guided by a risk-benefit analysis, prioritizing patient safety and diagnostic efficacy. Question 7. System analysis indicates that a radiologist is tasked with interpreting a complex cross-sectional imaging study of the abdomen and pelvis. The patient presents with vague abdominal pain and a history of prior surgery. Which of the following approaches best ensures a thorough and accurate interpretation, minimizing the risk of missed findings? Option A. A rapid scan of the images, prioritizing the identification of gross abnormalities and post-surgical changes. Option B. A systematic, region-by-region review of all visualized anatomy, followed by a focused assessment of areas of clinical concern. Option C. A review focused solely on the organs most likely to be affected by the patient's symptoms, as indicated by the clinical history. Option D. An interpretation based primarily on pattern recognition of common pathologies, with less emphasis on systematically reviewing all structures. The correct answer is B. A systematic, region-by-region review of all visualized anatomy, followed by a focused assessment of areas of clinical concern. Explanation. This scenario presents a common challenge in radiology, the need to interpret complex imaging findings within a structured, systematic framework to ensure accuracy and patient safety. The professional challenge lies in the potential for subtle abnormalities to be overlooked, leading to delayed or incorrect diagnoses. Adhering to a systematic approach is paramount for consistent, high-quality image interpretation, which is a core expectation of the American Board of Radiology certification. The correct approach represents best professional practice because it minimizes cognitive biases and ensures all relevant imaging features are evaluated. This systematic methodology aligns with the principles of quality assurance and patient care mandated by regulatory bodies overseeing medical practice, including those that inform the standards for board certification. It promotes thoroughness and reduces the likelihood of errors, directly contributing to patient well-being and the integrity of the diagnostic process. An incorrect approach, such as relying solely on pattern recognition without a systematic review, fails to meet professional standards. This can lead to overlooking critical findings, particularly in cases with atypical presentations or multiple concurrent abnormalities. Such a failure represents a deviation from best practices in diagnostic imaging and could be construed as a breach of professional responsibility, potentially impacting patient care and leading to adverse outcomes. Another incorrect approach, focusing only on the most obvious abnormality, similarly neglects the comprehensive evaluation required for accurate diagnosis and can result in missed secondary findings that may be clinically significant. This selective attention is contrary to the rigorous standards expected of certified radiologists. The professional decision-making process should involve a deliberate, step-by-step review of the imaging study, starting with patient history and clinical indication, followed by a systematic evaluation of each anatomical region and imaging sequence. This structured approach allows for the identification of both expected and unexpected findings, ensuring a complete and accurate interpretation. When faced with complex cases, radiologists should engage in critical self-assessment, consider differential diagnoses, and, when necessary, consult with colleagues or seek further information to ensure the highest quality of care. Question 8. Quality control measures reveal that the output constancy of a diagnostic X-ray unit, specifically its radiation intensity, has drifted by a statistically significant margin beyond the acceptable tolerance limits established by the American Association of Physicists in Medicine (APM) TG 142 report, which is a standard reference for ACR accreditation. The deviation was noted during a routine weekly check. What is the most appropriate immediate course of action? Option A. Immediately remove the diagnostic X-ray unit from clinical service and notify the radiation safety officer until the cause of the drift is identified and corrected by qualified personnel. Option B. Adjust the technique factors, KVP, M as, for each patient to compensate for the observed drift and maintain consistent image quality. Option C. Continue using the unit for clinical procedures, but schedule a physicist to investigate the drift within the next month. Option D. Document the drift in the unit's logbook and continue with routine clinical use, assuming the deviation is minor and unlikely to impact patient care. The correct answer is C. Continue using the unit for clinical procedures, but schedule a physicist to investigate the drift within the next month. Explanation. Scenario analysis. This scenario presents a common challenge in medical imaging departments where a discrepancy is identified during routine quality control. The professional challenge lies in accurately interpreting the findings of the quality control test, understanding its implications for patient safety and diagnostic accuracy, and determining the appropriate course of action within the established regulatory framework. The physicist must balance the need for immediate corrective action with the potential impact on clinical workflow and patient care, all while adhering to the stringent standards set by the American Board of Radiology, (ABR), for radiation physics and safety. Correct approach analysis. The correct approach involves a thorough investigation to identify the root cause of the observed deviation. This includes verifying the calibration of the measurement equipment used for quality control, ensuring the imaging system's parameters are within acceptable tolerances as defined by the manufacturer and regulatory guidelines, and assessing whether the deviation impacts image quality or patient dose. If the deviation is confirmed and found to be significant, the appropriate action is to remove the affected equipment from clinical service until it can be recalibrated or repaired by qualified personnel. This aligns with the ABR's emphasis on ensuring the safe and effective use of radiation-producing equipment, protecting both patients and staff from unnecessary radiation exposure and maintaining diagnostic image integrity. Adherence to established protocols for equipment performance testing and corrective actions is paramount. Incorrect approaches analysis. Continuing to use the equipment without further investigation or confirmation of the deviation is a significant regulatory and ethical failure. It directly contravenes the principles of radiation safety and quality assurance, potentially leading to compromised diagnostic images and increased patient radiation doses. This approach disregards the responsibility to ensure equipment is functioning as intended and can result in misdiagnosis or unnecessary repeat procedures. Attempting to adjust system parameters without a clear understanding of the underlying cause or without proper recalibration is also a failure. This can mask the true problem, leading to inconsistent performance and potentially exceeding acceptable dose limits or producing diagnostically unacceptable images. It bypasses the systematic troubleshooting required by quality control protocols. Relying solely on anecdotal evidence or the opinion of clinical staff without a systematic, physics-based investigation is another failure. While clinical feedback is valuable, it cannot replace the objective measurements and analysis required to identify and rectify equipment malfunctions. This approach lacks the rigor necessary to ensure compliance with radiation safety standards. Professional reasoning. professionals in this field should adopt a systematic approach to quality control findings. This involves 1. Acknowledging the finding and its potential implications. 2. Verifying the integrity of the quality control process itself, including equipment and methodology. 3. Conducting a detailed investigation to pinpoint the source of the deviation. 4. Consulting relevant technical manuals, regulatory guidelines, e.g., ACR practice parameters, FDA regulations pertaining to medical devices, and manufacturer specifications. 5. Implementing corrective actions based on the investigation's findings, prioritizing patient safety and diagnostic efficacy. 6. Documenting all steps taken, including the deviation, investigation, corrective actions, and retesting results. 7. Communicating findings and actions to relevant stakeholders, including the radiation safety officer and clinical staff. Question 9. The performance metrics show a statistically significant increase in the rate of indeterminate findings for interstitial lung disease on chest radiographs over the past quarter, particularly concerning the subtle differentiation between early reticular patterns and superimposed vascular markings. A radiologist responsible for reviewing these metrics is concerned about the potential impact on patient management. Which of the following actions best reflects a commitment to professional responsibility and patient safety in this context? Option A. Focus on documenting the limitations of radiographic interpretation for early interstitial lung disease in the report, without actively seeking to improve the accuracy of the initial interpretation. Option B. Initiate a targeted review of a sample of these indeterminate cases, correlating radiographic findings with available clinical history and prior imaging, and consult with a thoracic radiology subspecialist to refine interpretation criteria for subtle reticular opacities. Option C. Assume the increased rate is due to variations in patient populations or technical factors inherent to the imaging equipment, and continue with routine reporting without further investigation. Option D. Immediately implement a new, more aggressive reporting threshold for any suspected reticular pattern to reduce the number of indeterminate findings, regardless of the certainty of the radiographic sign. The correct answer is B. Initiate a targeted review of a sample of these indeterminate cases, correlating radiographic findings with available clinical history and prior imaging, and consult with a thoracic radiology subspecialist to refine interpretation criteria for subtle reticular opacities. Explanation: the performance metrics show a concerning trend in the interpretation of subtle radiographic signs of interstitial lung disease, specifically a higher than expected rate of missed or mischaracterized reticular opacities. This scenario is professionally challenging because it directly impacts patient care, potentially leading to delayed diagnosis, inappropriate treatment, and adverse outcomes. The radiologist's responsibility extends beyond simply identifying abnormalities. It includes accurate characterization and communication of findings to guide clinical management. The ethical imperative is to uphold the highest standards of diagnostic accuracy and patient safety, adhering to professional guidelines and best practices. The correct approach involves a systematic review of the concerning cases, cross-referencing findings with clinical information, and potentially consulting with colleagues or subspecialists. This demonstrates a commitment to continuous quality improvement and patient advocacy. It aligns with the American Board of Radiology's emphasis on lifelong learning and the physician's duty to ensure competence. By proactively addressing the performance metrics, the radiologist upholds professional integrity and the trust placed in them by patients and referring physicians. This approach prioritizes patient well-being and adherence to established diagnostic criteria for interstitial lung disease, ensuring that subtle radiographic signs are not overlooked. An incorrect approach would be to dismiss the performance metrics as statistical anomalies without further investigation. This fails to acknowledge the potential for systemic issues in interpretation or the need for skill refinement. Ethically, this constitutes a dereliction of duty to ensure diagnostic accuracy and patient safety, potentially violating principles of beneficence and non-maleficence. Another incorrect approach is to solely rely on automated reporting software without critical human oversight. While technology can assist, it cannot replace the nuanced judgment required for complex radiographic interpretation, especially concerning subtle findings. This approach risks perpetuating errors and failing to meet the standards of professional practice expected by the American Board of Radiology. A further incorrect approach is to focus on external factors or blame other departments for the discrepancies without internal reflection and corrective action. This deflects responsibility and hinders the process of identifying and rectifying diagnostic shortcomings, which is contrary to the principles of collaborative healthcare and professional accountability. The professional decision-making process for similar situations should involve a structured approach to quality assurance. This includes regularly reviewing performance data, identifying trends or outliers, conducting peer review or case conferences for challenging interpretations, seeking further education or training in areas of identified weakness, and implementing changes to workflow or reporting to mitigate identified risks. The ultimate goal is to ensure that diagnostic interpretations are accurate, timely, and effectively communicated to optimize patient care. Question 10. The analysis reveals that a nuclear medicine department is experiencing extended patient wait times for SPECT/CT myocardial perfusion imaging due to lengthy acquisition protocols. To address this, what approach best aligns with the principles of optimizing process efficiency while upholding diagnostic integrity and patient safety, as expected within the American Board of Radiology framework? Option A. Introduce new imaging protocols based on anecdotal evidence from other institutions without performing internal validation or considering the specific equipment and patient population. Option B. Prioritize reducing scan duration by significantly lowering the number of counts acquired per projection, regardless of the potential impact on signal-to-noise ratio and lesion detectability. Option C. Systematically evaluate and refine SPECT/CT acquisition parameters, such as matrix size, zoom, and iterative reconstruction settings, alongside patient preparation and positioning, to improve efficiency without compromising diagnostic accuracy. Option D. Implement a blanket reduction in acquisition time for all patients without adjusting other imaging parameters or validating the impact on image quality. The correct answer is D. Implement a blanket reduction in acquisition time for all patients without adjusting other imaging parameters or validating the impact on image quality. Explanation. Scenario analysis. This scenario presents a common challenge in nuclear medicine departments: optimizing workflow and patient throughput for SPECT/CT imaging while maintaining diagnostic quality and adhering to regulatory standards. The challenge lies in balancing the desire for efficiency with the fundamental requirement of providing accurate and safe patient care, which is paramount under the American Board of Radiology (ABR) framework. The ABR emphasizes competence in the application of imaging techniques, which includes understanding the factors that influence image quality and patient safety, even when not directly performing calculations. Correct approach analysis. The correct approach focuses on systematically evaluating and adjusting acquisition parameters and protocols based on established principles of nuclear medicine physics and imaging science, with the ultimate goal of improving image quality and reducing scan times without compromising diagnostic accuracy. This aligns with the ABR's emphasis on understanding the practical application of nuclear medicine techniques. Specifically, optimizing parameters like matrix size, zoom, and iterative reconstruction settings directly impact signal-to-noise ratio, spatial resolution, and lesion detectability. Furthermore, ensuring appropriate patient preparation and positioning is a critical component of image acquisition that falls within the scope of a radiologist's understanding of the imaging process. This approach represents best professional practice because it is grounded in scientific principles and directly contributes to patient safety and diagnostic efficacy, core tenets of medical practice overseen by the ABR. It demonstrates a commitment to continuous quality improvement within the established framework of nuclear medicine imaging. Incorrect approaches analysis. One incorrect approach involves prioritizing scan time reduction above all else, potentially by significantly reducing counts or increasing patient motion, without implementing compensatory measures. This would be a regulatory and ethical failure because it compromises image quality, leading to potential misdiagnosis or the need for repeat scans, which is inefficient and exposes the patient to unnecessary radiation. The ABR expects practitioners to understand the trade-offs between speed and quality. Another incorrect approach would be to implement changes to imaging protocols without proper validation or understanding of their impact on image reconstruction and diagnostic interpretation. This could lead to artifacts or altered quantitative values, violating the principle of providing accurate diagnostic information. A further incorrect approach might involve neglecting patient comfort or preparation, which can indirectly affect image quality and patient cooperation, thereby impacting the diagnostic yield and potentially violating ethical considerations of patient care. Professional reasoning. Professionals should approach process optimization by first understanding the current workflow and identifying specific bottlenecks or areas for improvement. This involves a thorough review of existing protocols, patient feedback, and image quality metrics. The next step is to research and propose evidence-based modifications to acquisition parameters, reconstruction algorithms, or patient preparation procedures. These proposed changes should then be rigorously tested and validated, ideally through phantom studies or controlled clinical trials, to assess their impact on image quality, diagnostic accuracy, and patient safety. Collaboration with technologists and medical physicists is crucial throughout this process. Decision-making should be guided by the principle of do no harm and the commitment to providing the highest quality diagnostic information to referring physicians and patients, all within the regulatory and ethical guidelines set forth by the ABR. Question 11. Operational review demonstrates that a significant number of follow-up imaging studies for patients with previously treated early-stage breast cancer are being performed with PET/CT scans every 6 months, irrespective of the patient's current clinical status or the presence of any new symptoms. What is the most appropriate approach to optimize imaging utilization in this patient population? Option A. Continue the current practice of 6-month PET/CT surveillance for all patients to ensure the earliest possible detection of any metastatic disease. Option B. Implement a surveillance protocol that utilizes mammography and targeted ultrasound as primary imaging modalities for routine follow-up, reserving PET/CT for cases with specific clinical indications of suspected recurrence. Option C. Transition all follow-up imaging to MRI of the breast and chest, as it offers superior soft tissue contrast for detecting subtle changes. Option D. Discontinue all routine follow-up imaging for patients with early-stage breast cancer, relying solely on clinical examination for detection of recurrence. The correct answer is B. Implement a surveillance protocol that utilizes mammography and targeted ultrasound as primary imaging modalities for routine follow-up, reserving PET/CT for cases with specific clinical indications of suspected recurrence. Explanation. Scenario analysis. This scenario presents a common challenge in oncology imaging, balancing the need for comprehensive staging and accurate follow-up with the potential for over-imaging and associated patient risks and healthcare costs. The challenge lies in adhering to evidence-based guidelines, institutional protocols, and the specific needs of the patient and their oncologic condition, all while navigating the evolving landscape of imaging technology and its appropriate application. Radiologists must critically evaluate the purpose of each imaging study in the context of the patient's cancer type, stage, treatment plan, and clinical status. Correct approach analysis. The correct approach emphasizes the judicious use of imaging for staging and follow-up, aligning with established best practices and regulatory expectations for quality patient care in oncology. This involves selecting imaging modalities and protocols that are most appropriate for the specific cancer type and stage, and for detecting recurrence or treatment response. It prioritizes imaging that directly impacts clinical decision-making, such as guiding treatment adjustments, assessing treatment efficacy, or detecting clinically significant disease progression. This approach is ethically sound, as it minimizes unnecessary radiation exposure and healthcare expenditures while maximizing diagnostic yield. It aligns with the principles of responsible resource utilization and patient safety, which are implicit in the American Board of Radiology's commitment to high standards of medical practice. Incorrect approaches analysis. One incorrect approach involves routinely ordering advanced cross-sectional imaging for all patients with a history of cancer, regardless of their current clinical status or the specific surveillance recommendations for their cancer type. This represents a failure to adhere to evidence-based guidelines and can lead to overdiagnosis, unnecessary biopsies, increased patient anxiety, and significant financial burden. Ethically, it violates the principle of non-maleficence by exposing patients to potential harms of imaging without clear clinical benefit. Another incorrect approach is to rely solely on a single imaging modality for all follow-up scenarios, even when other modalities might offer superior sensitivity or specificity for detecting specific types of recurrence or metastasis. This demonstrates a lack of understanding of the strengths and limitations of different imaging techniques in the context of oncologic surveillance and can lead to misdiagnoses or misinterpretations. This approach fails to meet the standard of care expected in oncology imaging, potentially impacting patient outcomes. A third incorrect approach is to disregard patient-reported symptoms or clinical concerns in favor of a standardized imaging schedule. While guidelines are important, patient symptoms can be early indicators of recurrence that may warrant earlier or different imaging. Ignoring these clinical cues can delay diagnosis and treatment, negatively impacting prognosis. This approach demonstrates a failure to integrate clinical information with imaging, which is a cornerstone of effective patient management. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough understanding of the patient's specific cancer diagnosis, stage, and treatment history. This should be followed by a review of current, evidence-based guidelines for staging and follow-up imaging for that particular cancer type. The radiologist must then consider the patient's individual clinical status, including any new symptoms or changes in physical examination, and the specific clinical question the imaging is intended to answer. The choice of imaging modality and protocol should be based on its ability to answer that question safely and effectively, with consideration for radiation dose and cost. Regular review of institutional protocols and participation in multidisciplinary tumor boards further enhance decision-making. Question 12. Research into the interpretation of a chest radiograph reveals a focal opacity in the right upper lobe. The patient is a 65-year-old male with a history of smoking and recent onset of cough and hemoptysis. Which of the following approaches to risk assessment and diagnosis is most appropriate in this scenario? Option A. Focus solely on the radiographic appearance of the opacity, classifying it as a nodule or mass based on size criteria, and deferring any clinical correlation or differential diagnosis to the referring physician. Option B. Immediately conclude that the opacity represents a primary lung malignancy given the patient's smoking history and hemoptysis, and proceed with reporting this as the definitive diagnosis. Option C. Prioritize the most common causes of focal opacities in smokers, such as pneumonia or tuberculosis, and formulate a diagnosis based on these prevalent conditions. Option D. Conduct a thorough review of the imaging characteristics of the opacity, correlate with the patient's clinical presentation, and develop a differential diagnosis that includes malignancy, infection, and inflammatory processes, followed by a recommendation for further investigation. The correct answer is C. Prioritize the most common causes of focal opacities in smokers, such as pneumonia or tuberculosis, and formulate a diagnosis based on these prevalent conditions. Explanation. This scenario presents a professional challenge due to the inherent responsibility of a radiologist to accurately identify and characterize pathologies, which directly impacts patient care and treatment decisions. The need for precise recognition of common pathologies across various organ systems requires a robust understanding of imaging findings and their clinical correlations. The risk assessment aspect is critical because misinterpreting findings can lead to delayed or incorrect diagnoses, potentially causing patient harm and increasing healthcare costs. The correct approach represents best professional practice because it emphasizes a systematic and comprehensive review of imaging studies, integrating knowledge of common pathologies with the specific clinical context. This aligns with the American Board of Radiology's mandate for physicians to possess the knowledge and skills necessary for accurate diagnosis and patient management. Adherence to established diagnostic criteria and guidelines, coupled with continuous learning and consultation when necessary, ensures the highest standard of care and minimizes diagnostic errors, thereby fulfilling ethical obligations to patients and upholding professional integrity. An incorrect approach that relies solely on pattern recognition without considering the clinical history or differential diagnosis is professionally unacceptable. This failure to integrate all available information can lead to overlooking subtle but significant findings or misattributing findings to common conditions when a rarer, more serious pathology is present. This violates the ethical principle of beneficence by not acting in the patient's best interest and can lead to regulatory scrutiny for substandard care. Another incorrect approach that involves prematurely concluding a diagnosis without a thorough differential diagnosis is also professionally unsound. This can result in confirmation bias, where the radiologist seeks evidence to support an initial impression while ignoring contradictory findings. This not only compromises diagnostic accuracy, but also fails to meet the professional standard of providing a comprehensive and objective interpretation, potentially leading to patient harm and a breach of professional duty. Finally, an approach that neglects to document the rationale for the diagnostic impression, especially in complex cases, is professionally deficient. Clear and concise documentation is crucial for communication with referring physicians, for continuity of care, and for medico-legal purposes. Failure to adequately document the thought process can obscure the radiologist's reasoning, making it difficult to review or defend the interpretation, and potentially leading to misunderstandings or errors in subsequent patient management. The professional decision-making process for similar situations should involve a structured approach. First, thoroughly review the imaging data, paying attention to all visible structures and any abnormalities. Second, critically evaluate the clinical information provided, considering the patient's history, symptoms, and prior investigations. Third, formulate a differential diagnosis based on the imaging findings and clinical context. Fourth, systematically assess each differential diagnosis against the imaging evidence, considering the likelihood of each possibility. Fifth, consult with colleagues or relevant literature when faced with uncertainty or unusual findings. Sixth, clearly and comprehensively document the findings, the differential diagnosis, and the final impression, including the rationale for the chosen diagnosis. Question 13. Examination of the data shows a 65-year-old male presenting with acute onset of severe abdominal pain. Imaging reveals a focal, circumferential, thickened segment of the distal small bowel with associated mesenteric edema and stranding. There is no evidence of free air or significant dilation proximal to the affected segment. Which of the following represents the most appropriate initial differential diagnosis to consider based on these imaging findings? Option A, diverticulitis. Option B, appendicitis. Option C, ischemic bowel disease. Option D, peptic ulcer disease. Correct answer is C, ischemic bowel disease. Explanation. This scenario presents a common challenge in diagnostic radiology, differentiating between multiple potential etiologies for a given set of imaging findings. The professional challenge lies in synthesizing complex imaging data, patient history, and clinical context to arrive at the most accurate and timely diagnosis, thereby guiding appropriate patient management. Failure to do so can lead to delayed or incorrect treatment, potentially harming the patient. The American Board of Radiology, ABR, emphasizes a rigorous understanding of differential diagnoses based on imaging findings, as this is a cornerstone of safe and effective medical practice. The correct approach represents best professional practice because it prioritizes a systematic and comprehensive evaluation of all plausible diagnoses that fit the observed imaging features. This aligns with the ABR's commitment to ensuring radiologists possess the knowledge and judgment to provide high-quality diagnostic interpretations. Best practice involves considering the relative likelihood of each differential diagnosis based on prevalence, patient demographics, and clinical presentation, and then formulating a plan for further investigation or management that addresses the most concerning possibilities. This methodical approach minimizes the risk of overlooking critical diagnoses and ensures patient safety, a paramount ethical and regulatory concern. An incorrect approach that focuses solely on the most common diagnosis without considering less frequent but potentially more serious alternatives represents a failure in comprehensive diagnostic reasoning. This could lead to a misdiagnosis of a critical condition, violating the ethical duty to provide diligent care, and potentially contravening regulatory expectations for thoroughness in radiological interpretation. Another incorrect approach, such as prematurely concluding the diagnosis without adequate consideration of all imaging findings or relevant clinical information, demonstrates a lack of critical analysis and can result in diagnostic errors. This falls short of the professional standards expected by the ABR, which requires a deep understanding of imaging pathology and its differential diagnoses. A third incorrect approach, which might involve over-reliance on a single imaging modality without considering the strengths and limitations of others or the value of clinical correlation, also represents a failure in best professional practice. This can lead to incomplete or inaccurate diagnoses, undermining the radiologist's role in the multidisciplinary care team and potentially violating regulatory standards for diagnostic accuracy. The professional decision-making process for similar situations should involve a structured approach. 1. Thoroughly review all available imaging data, noting all positive and negative findings. 2. Integrate the patient's clinical history, laboratory results, and other relevant information. 3. Generate a broad differential diagnosis list based on the imaging findings. 4. Rank the differential diagnoses by likelihood, considering prevalence and clinical context. 5. Determine if further imaging, clinical correlation, or consultation is necessary to refine the diagnosis. 6. Communicate the findings and differential diagnosis clearly and concisely in the radiology report, providing recommendations for further management or investigation. Question 14. The monitoring system demonstrates a PET scan showing increased radiotracer uptake in a focal area of the liver, with no other significant findings noted on the current study. The patient has a history of treated malignancy. Which of the following approaches best represents the evaluation of this finding in accordance with best professional practice for diagnostic interpretation? Option A. Recommend immediate biopsy of the focal liver uptake based on the increased radiotracer signal, without further comparative analysis or clinical correlation. Option B. Report the focal liver uptake as a new lesion suspicious for recurrence, as increased uptake in a patient with a history of malignancy is always indicative of disease progression. Option C. Focus solely on the most intensely hypermetabolic focus in the liver, interpreting it as the primary site of concern without considering other potential areas of uptake or the overall distribution pattern. Option D. Compare the current PET scan with all previous imaging studies, including prior PET scans, CT, and MRIs, and correlate the findings with the patient's clinical history and relevant laboratory values to assess for changes indicative of recurrence or treatment response. The correct answer is D. Compare the current PET scan with all previous imaging studies, including prior PET scans, CT, and MRIs, and correlate the findings with the patient's clinical history and relevant laboratory values to assess for changes indicative of recurrence or treatment response. Explanation. The monitoring system demonstrates a scenario that is professionally challenging due to the inherent variability in radiotracer uptake and the potential for misinterpretation of functional imaging findings, especially when subtle changes occur over time. This requires careful judgment to differentiate true disease progression or response from physiological fluctuations or technical artifacts. The American Board of Radiology, ABR, emphasizes the importance of accurate interpretation and reporting of diagnostic imaging, including functional imaging modalities like PET and SPECT, to ensure appropriate patient care and adherence to established medical standards. The correct approach represents best professional practice because it prioritizes a comprehensive, multifaceted evaluation that integrates imaging findings with clinical context and prior studies. This aligns with ABR guidelines that stress the importance of thoroughness and accuracy in diagnostic radiology. Specifically, comparing current PET/SPECT findings with previous studies, considering the patient's clinical history and laboratory values, and consulting with referring physicians ensures that the interpretation is not solely based on isolated imaging data, but rather on a holistic understanding of the patient's condition. This systematic approach minimizes the risk of misdiagnosis and supports evidence-based clinical decision-making, which is a cornerstone of professional responsibility and patient safety. An incorrect approach that relies solely on the current PET/SPECT scan, without comparison to prior imaging or clinical correlation, is professionally unacceptable. This failure represents a deviation from best practice by neglecting crucial contextual information that could significantly alter the interpretation. Such an approach risks overinterpreting incidental findings or underestimating subtle but significant changes, potentially leading to inappropriate treatment decisions or delayed diagnosis. This is a regulatory and ethical failure, as it compromises the quality of diagnostic interpretation and fails to uphold the standard of care expected of a radiologist. Another incorrect approach that focuses only on the most intensely active lesion without considering other areas of tracer uptake or the overall pattern of distribution is also professionally unacceptable. This narrow focus can lead to an incomplete assessment of disease extent or response, potentially overlooking multifocal disease or diffuse processes. This represents a failure to conduct a comprehensive review of the entire scan, which is a fundamental requirement for accurate interpretation. Ethically, this can result in an incomplete or misleading report, impacting patient management. A third incorrect approach that prioritizes the identification of the most interesting finding over a systematic and objective evaluation of all imaging data is professionally unsound. This subjective bias can lead to an unbalanced interpretation, where less dramatic but clinically significant findings are overlooked. This approach fails to adhere to the objective standards of diagnostic interpretation and can lead to a biased report, which is both a regulatory and ethical concern, as it undermines the integrity of the diagnostic process. The professional reasoning process for similar situations should involve a systematic checklist. First, review the technical quality of the scan. Second, correlate findings with the patient's clinical history, symptoms, and relevant laboratory data. Third, meticulously compare the current study with all prior relevant imaging, including previous PET/SPECT scans, CT, and MRIs. Fourth, analyze the distribution and intensity of radiotracer uptake in relation to normal physiological patterns and known pathological processes. And finally, formulate a concise and accurate report that clearly communicates findings, limitations, and recommendations, facilitating informed clinical decision-making. Question 15. To address the challenge of a patient presenting for a contrast-enhanced ultrasound with a documented history of allergy to iodine-based contrast, which of the following approaches best aligns with the American Board of Radiology's expectations for safe and effective diagnostic imaging practices? Option A. Administer a small test dose of the contrast agent to assess for immediate reaction before proceeding with the full dose. Option B. Delay the ultrasound, contact the referring physician to clarify the nature and severity of the allergy, and discuss alternative imaging strategies if necessary. Option C. Proceed with the contrast-enhanced ultrasound, assuming the allergy is likely mild and the diagnostic benefit outweighs the potential risk. Option D. Perform the ultrasound without contrast, as the documented allergy presents an absolute contraindication. The correct answer is C. Proceed with the contrast-enhanced ultrasound, assuming the allergy is likely mild and the diagnostic benefit outweighs the potential risk. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the sonographer to balance the immediate need for diagnostic information with the potential for patient harm due to an unconfirmed allergy. The sonographer must make a judgment call without complete information, necessitating a risk assessment that prioritizes patient safety while still aiming to fulfill the clinical request. The challenge lies in navigating uncertainty and adhering to established protocols for patient care and safety in diagnostic imaging. Correct approach analysis. The correct approach represents best professional practice because it directly addresses the potential for anaphylaxis, a severe and life-threatening allergic reaction, which is a primary safety concern in any medical procedure involving contrast agents. By delaying the administration of the contrast agent and initiating a conversation with the referring physician to clarify the allergy status and explore alternatives, the sonographer is adhering to the fundamental ethical and regulatory principle of do no harm, non-maleficence. This approach aligns with guidelines from professional bodies like the American Institute of Ultrasound in Medicine, (AIM), and the American College of Radiology, (ACR), which emphasize thorough patient history, risk assessment, and communication with the referring physician when contraindications or uncertainties exist. It also reflects the radiologist's ultimate responsibility for the interpretation of the study and the safety of the procedures performed under their supervision, as outlined by the American Board of Radiology, (ABR), expectations for qualified practitioners. This proactive communication ensures that the patient receives the safest and most appropriate diagnostic imaging. Incorrect approaches analysis. Proceeding with the contrast-enhanced ultrasound without further clarification of the allergy status is a significant regulatory and ethical failure. It disregards the potential for a severe adverse reaction, violating the principle of non-maleficence. This action would be considered negligent and could lead to serious patient harm, contravening established patient safety protocols and potentially violating accreditation standards for imaging facilities. Administering a test dose of the contrast agent without consulting the referring physician or a supervising radiologist is also professionally unacceptable. While a test dose might seem like a way to assess tolerance, it does not eliminate the risk of a severe reaction, and doing so without proper medical oversight and a clear protocol is a deviation from standard practice. It bypasses the established chain of command and decision-making process for managing potential adverse events. Assuming the allergy is not severe enough to warrant cancellation and proceeding with the contrast agent is a dangerous assumption. The severity of allergic reactions can be unpredictable, and even a history of a mild reaction can escalate to a life-threatening one. This approach demonstrates a failure to adequately assess risk and prioritize patient safety, which is a core tenet of medical practice and regulatory compliance. Professional reasoning. In situations involving potential patient risk, the professional decision-making process should always begin with a thorough risk assessment. This involves identifying potential hazards, e.g., allergic reaction to contrast, evaluating the likelihood and severity of harm, and determining the most effective strategies to mitigate those risks. When uncertainty exists, as with an unconfirmed allergy, the paramount principle is patient safety. This necessitates clear communication with the referring physician or supervising radiologist to obtain clarification, discuss alternative imaging techniques, or confirm that the benefits of contrast administration outweigh the risks. Adherence to institutional protocols and professional guidelines is crucial. If a procedure cannot be performed safely due to identified risks, it should be postponed or modified until those risks are adequately addressed. Question 16. Analysis of a posterior and lateral chest radiograph reveals a well-defined, rounded opacity in the right upper lobe. The patient is a 65-year-old male with a history of smoking and recent onset of cough and hemoptysis. Which of the following approaches best guides the radiologist in formulating a differential diagnosis and recommending further management? Option A. Focus solely on the possibility of pneumonia and recommend empiric antibiotic treatment. Option B. Immediately recommend a CT scan of the chest to further characterize the opacity and rule out malignancy, considering the patient's risk factors and symptoms. Option C. Prioritize a benign granulomatous process given the well-defined nature of the opacity and proceed with routine follow-up imaging. Option D. Conclude that the opacity represents a simple cyst and no further investigation is required. Correct answer is C. Prioritize a benign granulomatous process given the well-defined nature of the opacity and proceed with routine follow-up imaging. Explanation. This scenario presents a common challenge in diagnostic radiology, differentiating between multiple pathologies that can manifest with overlapping imaging findings on a chest radiograph. The professional challenge lies in accurately identifying the most likely diagnosis based on subtle radiographic clues, patient history, and clinical context, while also considering less common but critical differential diagnoses. This requires a systematic approach to image interpretation and a thorough understanding of the radiographic characteristics of various pulmonary and pleural diseases. The correct approach represents best professional practice because it prioritizes a comprehensive and systematic evaluation of the chest radiograph. This involves not only identifying the primary abnormality, but also meticulously assessing surrounding structures and considering the patient's clinical presentation. This aligns with the ethical and professional obligation to provide accurate and timely diagnoses, minimizing the risk of misdiagnosis and ensuring appropriate patient management. Adherence to established diagnostic algorithms and differential diagnosis frameworks, as expected in radiology practice governed by professional standards and guidelines, is paramount. An incorrect approach that focuses solely on the most obvious finding without considering the broader differential diagnosis is professionally unacceptable. This can lead to misdiagnoses of serious conditions or inappropriate treatment based on an incomplete assessment. Ethically, this represents a failure to exercise due diligence and provide the standard of care expected of a radiologist. Regulatory frameworks, such as those guiding medical practice and board certification, emphasize thoroughness and the consideration of all plausible diagnoses. Another incorrect approach that relies heavily on a single, less specific finding without corroborating evidence or consideration of other possibilities is also flawed. This demonstrates a lack of critical thinking and an incomplete interpretation, potentially leading to diagnostic errors. This violates the principle of providing a comprehensive diagnostic report that reflects a thorough analysis of the imaging study. A third incorrect approach that dismisses findings that do not fit a preconceived diagnosis, even if they are subtle but significant, is equally problematic. This reflects confirmation bias and a failure to objectively evaluate all imaging data. Such an approach can have serious consequences for patient care, as it may overlook critical diagnostic information. The professional reasoning process for similar situations should involve a structured approach. 1. Review the clinical history and reason for the exam. 2. Systematically evaluate the chest radiograph, assessing lung parenchyma, pleura, mediastinum, bones, and soft tissues. 3. Identify and characterize any abnormalities. 4. Generate a differential diagnosis based on the imaging findings and clinical context. 5. Prioritize the differential diagnosis based on likelihood and clinical significance. 6. Formulate a concise and informative report that clearly communicates the findings and recommendations. 7. Consult with referring physicians when necessary for clarification or further management planning. Question 17. The monitoring system demonstrates a trend of slightly elevated radiation dose indices for pediatric abdominal CT examinations compared to established institutional benchmarks, despite the use of pediatric-specific protocols. What is the most appropriate next step to address this observation? Option A. Assume the monitoring system is generating false positives due to variations in pediatric body habitus and disregard the trend. Option B. Implement a mandatory one-time retraining session for all radiology staff on general radiation safety principles without specific focus on pediatric imaging. Option C. Conduct a targeted educational session for technologists focusing on pediatric CT acquisition techniques, collimation, and appropriate use of shielding, followed by a review of recent pediatric CT dose reports and image quality assessments. Option D. Immediately reduce the tube current time product M, as for all pediatric abdominal CT protocols, by 15% to ensure ALARA compliance. The correct answer is C. Conduct a targeted educational session for technologists focusing on pediatric CT acquisition techniques, collimation, and appropriate use of shielding, followed by a review of recent pediatric CT dose reports and image quality assessments. Explanation. Scenario analysis. This scenario presents a common implementation challenge in pediatric imaging, ensuring consistent adherence to ALARA principles across a diverse patient population with varying anatomical needs and cooperation levels. The challenge lies in balancing the need for diagnostic image quality with the imperative to minimize radiation dose, especially in children who are more radiosensitive. The monitoring system's data highlights a potential gap between established protocols and actual practice, necessitating a review of the implementation strategy. Correct approach analysis. The correct approach involves a multifaceted strategy that directly addresses the observed data. This includes targeted education for technologists on pediatric-specific imaging techniques and dose reduction strategies, such as appropriate collimation and shielding, and utilizing pediatric-specific protocols. Furthermore, regular quality assurance reviews of image acquisition parameters and dose reports for pediatric exams are crucial. This aligns with the American Board of Radiology's emphasis on continuous learning, quality improvement, and patient safety, which are foundational to responsible medical imaging practice. The focus on education and QA directly supports the ALARA principle by ensuring that technologists are equipped with the knowledge and tools to optimize dose for each pediatric patient. Incorrect approaches analysis. One incorrect approach would be to dismiss the data as an anomaly without further investigation. This fails to acknowledge the potential for systemic issues in protocol implementation or technologist training, which could lead to suboptimal radiation doses. Ethically and professionally, ignoring data that suggests potential patient harm is unacceptable. Another incorrect approach would be to implement a blanket reduction in all pediatric imaging parameters without considering diagnostic efficacy. This could compromise image quality, leading to repeat scans or misdiagnosis, which is counterproductive and potentially harmful to the patient. It also disregards the need for individualized patient care and protocol optimization. A third incorrect approach would be to solely rely on the monitoring system's alerts without providing additional support or education to the technologists. The system is a tool for identification, not a complete solution. Without addressing the root causes of deviations, the problem is likely to persist. This approach neglects the professional responsibility to foster a culture of learning and improvement within the department. Professional reasoning. Professionals should approach such challenges by first acknowledging the data from the monitoring system as a signal for review. The next step is to investigate the underlying causes, which may involve reviewing protocols, technologist training, equipment performance, and patient factors. Based on this investigation, a targeted intervention such as education, protocol refinement, or equipment adjustment should be implemented. Continuous monitoring and evaluation of the intervention's effectiveness are essential to ensure sustained compliance with ALARA principles and optimal patient care. This systematic approach ensures that decisions are evidence-based and prioritize patient safety and diagnostic accuracy. Question 18. The assessment process reveals a lytic bone lesion in the proximal femur of a 65-year-old male with a history of prostate cancer. Radiographic imaging demonstrates cortical thinning and a poorly defined margin, with a small associated soft tissue component. While some features are suggestive of a metastatic deposit, a benign process such as an aneurysmal bone cyst or a brown tumor of hyperparathyroidism cannot be entirely excluded based on imaging alone. The patient reports mild, intermittent pain at the site. What is the most appropriate next step in management? Option A. Proceed with surgical curettage and bone grafting without further diagnostic intervention. Option B. Advise the patient to monitor the lesion with serial radiographs over the next 6 months. Option C. Recommend a core needle biopsy of the lesion for definitive histological diagnosis. Option D. Prescribe a course of non-steroidal anti-inflammatory drugs and reassess pain levels. The correct answer is C. Recommend a core needle biopsy of the lesion for definitive histological diagnosis. Explanation. This scenario presents a common clinical challenge in musculoskeletal imaging, differentiating between benign and malignant bone lesions, particularly when initial findings are equivocal. The professional challenge lies in balancing the need for accurate diagnosis and timely intervention for potentially life-threatening conditions against the risks and costs associated with unnecessary invasive procedures or delayed treatment. Radiologists must integrate clinical information, imaging findings, and knowledge of differential diagnoses to guide patient management effectively. The American Board of Radiology, ABR, emphasizes a physician's responsibility to provide accurate and timely diagnostic interpretations, adhering to established standards of care and ethical principles. The correct approach, which involves recommending a biopsy for definitive diagnosis when imaging findings are suspicious for malignancy, represents best professional practice. This aligns with ABR's core principles of ensuring patient safety and providing high-quality diagnostic services. A biopsy is the gold standard for confirming or excluding malignancy, allowing for appropriate treatment planning and avoiding the potential for disease progression if a malignant lesion is missed or misdiagnosed. This approach prioritizes patient well-being and adheres to the principle of do no harm by seeking definitive answers when uncertainty exists. An incorrect approach would be to dismiss the lesion as benign without further investigation, especially given the presence of concerning features like cortical destruction or a soft tissue mass. This failure to pursue a definitive diagnosis when indicated constitutes a breach of professional responsibility and could lead to significant patient harm due to delayed treatment of a malignancy. Ethically, this represents a failure to act in the patient's best interest. Another incorrect approach would be to immediately recommend aggressive surgical intervention without a tissue diagnosis. This is professionally unacceptable as it exposes the patient to the risks of major surgery and potential morbidity without a confirmed diagnosis, violating the principle of judicious use of resources and patient safety. It also bypasses the standard diagnostic pathway for bone lesions. The professional decision-making process in such cases should involve a systematic evaluation. First, thoroughly reviewing all available imaging modalities and correlating them with the clinical presentation. Second, considering the differential diagnoses based on the imaging characteristics and patient demographics. Third, if suspicion for malignancy remains high, or if there are concerning features that cannot be definitively attributed to a benign process, recommending the most appropriate next step for definitive diagnosis, which in many cases of suspected bone malignancy is a biopsy. This iterative process ensures that patient care is guided by evidence and sound clinical judgment, always prioritizing patient safety and optimal outcomes. Question 19. What factors determine the selection of the optimal percutaneous access site for complex arterial interventions in the lower extremities, considering patient anatomy, lesion characteristics, and potential for future interventions? Option A. The selection is based solely on the operator's familiarity with a particular access site, irrespective of the patient's specific anatomical considerations or lesion complexity. Option B. The decision is made based on the most superficial and easily palpable vessel, without regard for its suitability for the intervention or future access needs. Option C. The choice is primarily dictated by the availability of the smallest caliber guide wire that can safely traverse the lesion, regardless of downstream implications. Option D. The primary determinant is the most direct and shortest path to the target lesion, minimizing radiation exposure and contrast utilization, while preserving potential access sites for subsequent procedures. The correct answer is D. The primary determinant is the most direct and shortest path to the target lesion, minimizing radiation exposure and contrast utilization, while preserving potential access sites for subsequent procedures. Explanation. This scenario is professionally challenging because interventional radiology techniques, while offering significant patient benefits, also carry inherent risks. The selection of the most appropriate technique requires a comprehensive understanding of patient-specific factors, procedural risks, potential benefits, and adherence to established best practices and guidelines, all within the regulatory framework governing medical practice in the United States, as overseen by bodies like the American Board of Radiology (ABR) and relevant professional societies. The correct approach represents best professional practice because it prioritizes patient safety and optimal outcomes by considering a holistic view of the patient and the procedure. This aligns with the ABR's emphasis on competence and ethical conduct, ensuring that decisions are evidence-based and tailored to individual patient needs. It reflects a commitment to the principles of beneficence and non-maleficence, fundamental to medical ethics and professional responsibility. An incorrect approach that solely focuses on the perceived ease of a particular technique, without thorough patient assessment, would represent a failure to uphold the standard of care. This could lead to suboptimal outcomes or preventable complications, violating ethical obligations and potentially contravening guidelines from organizations like the Society of Interventional Radiology, (CER), which inform best practices and are implicitly recognized within the ABR's scope. Another incorrect approach, such as selecting a technique based on equipment availability without considering its suitability for the specific clinical indication, demonstrates a lack of due diligence and a potential disregard for patient well-being, which is a critical ethical and professional failing. A third incorrect approach, neglecting to discuss alternative techniques and their associated risks and benefits with the patient, constitutes a failure in informed consent, a cornerstone of ethical medical practice and a requirement for patient autonomy. Professional reasoning in such situations involves a systematic evaluation process. First, thoroughly assessing the patient's clinical condition, comorbidities, and preferences. Second, reviewing the available evidence and guidelines for various interventional techniques applicable to the specific pathology. Third, weighing the potential benefits against the risks of each technique in the context of the individual patient. And finally, engaging in shared decision-making with the patient, ensuring they understand the rationale behind the chosen approach and any alternatives. Question 20. The audit findings indicate a discrepancy in the interpretation of a chest radiograph, specifically concerning a small nodular opacity in the lung periphery. The radiologist's report described it as a suspicious nodule requiring follow-up, while the audit suggests it may represent a benign finding. Which of the following approaches best reflects the appropriate diagnostic reasoning in this scenario? Option A. Compare the opacity to known patterns of benign lung nodules and common anatomical variants, considering the patient's age and smoking history, to determine if it falls within the spectrum of normal or benign findings. Option B. Focus solely on the radiologist's initial impression, assuming their interpretation is correct and no further analysis is needed. Option C. Immediately classify the opacity as potentially malignant and recommend a CT scan for further evaluation, prioritizing the detection of any possible malignancy. Option D. Report the opacity as definitively benign based on its small size alone, assuming it is unlikely to represent a significant pathology. Correct answer is A. Compare the opacity to known patterns of benign lung nodules and common anatomical variants, considering the patient's age and smoking history, to determine if it falls within the spectrum of normal or benign findings. Explanation. Scenario analysis. This scenario presents a common challenge in diagnostic imaging where subtle variations in image appearance can be misinterpreted. The professional challenge lies in distinguishing between benign anatomical variations that mimic pathology and true abnormalities requiring intervention. This requires a deep understanding of normal anatomical variations, common benign findings, and the characteristic imaging features of various pathologies, all within the context of established diagnostic criteria and quality assurance standards. The audit findings highlight the need for consistent and accurate interpretation to ensure patient safety and appropriate clinical management. Correct approach analysis. The correct approach involves a meticulous comparative analysis of the imaging findings against established norms and known benign variations. This requires the radiologist to leverage their comprehensive knowledge base, including anatomical variations, common benign lesions, and the specific imaging characteristics of the modality used. The justification for this approach is rooted in the American Board of Radiology's emphasis on accurate diagnosis and patient care, which necessitates the ability to correctly identify both normal and abnormal findings. Adherence to established diagnostic criteria and guidelines ensures that interpretations are evidence-based and contribute to appropriate clinical decision-making, thereby upholding professional standards and patient well-being. Incorrect approaches analysis. One incorrect approach would be to over-attribute subtle findings to pathology without considering the possibility of normal anatomical variation or benign changes. This could lead to unnecessary patient anxiety, further investigations, and potentially inappropriate treatment, violating ethical principles of beneficence and non-maleficence. Another incorrect approach is to dismiss findings that deviate from the absolute ideal of normal without a thorough differential diagnosis, potentially missing early signs of disease. This failure to critically evaluate all findings, even those that appear minor, represents a lapse in due diligence and can have serious consequences for patient outcomes. A third incorrect approach would be to rely solely on automated software or pattern recognition without independent radiological judgment, as these systems may not account for all individual anatomical variations or subtle contextual clues, leading to misinterpretations. Professional reasoning. Professionals should approach such situations by first establishing a baseline understanding of normal anatomy and common variation relevant to the specific imaging study and patient demographic. They should then systematically evaluate each finding, considering its location, size, shape, signal intensity/attenuation, and enhancement characteristics. A differential diagnosis should be formulated, weighing the likelihood of benign versus malignant causes. Consulting relevant literature, atlases of anatomical variations, and peer review can further refine the interpretation. The decision-making process should prioritize patient safety and the principle of first, do no harm, ensuring that any reported abnormality is supported by sufficient evidence and that benign findings are not overcalled.